Dr. Bratcher, thanks for joining us here on Health Connection. Always a pleasure to have you. Our topic is diabetes. It's our New Year's pre-diabetes wake-up call. Let's start with a definition. What is pre-diabetes?
Well, pre-diabetes is really a relatively new term that medicine and physicians are using to describe a condition before you can actually call it diabetes. There are things that happen to patients where they may have minor alterations in metabolic functions, and the importance is that because obviously pre-diabetes leads to diabetes, but we have a chance to do something about it if we know that you quote have pre-diabetes.
Is it at all related to metabolic syndrome?
Yes, metabolic syndrome is a term that they used back maybe about 10 years ago, but those same factors are really what make you pre-diabetic.
So we're just now calling it pre-diabetes.
Right, and we assign some numbers to it, like certain blood sugars. Basically, you know, it's just a continuum. So we had to mark an X on the line somewhere and say this is diabetes, but obviously pre-diabetes is just basically the other side of where we put X on the line.
Okay, makes sense. A Centers for Disease Control report last year said that only 10% of adults with pre-diabetes even know they have it. Why is that?
It's probably because it's asymptomatic. The numbers aren't abnormal enough to give you any symptoms to know it. The other thing is that it's not necessarily screened in an otherwise young, you know, middle-aged or healthy young adult.
How common is pre-diabetes? What causes it?
Unfortunately, it's very common. It's estimated as many as 75 million persons in America have it. And it's linked to the same things that diabetes. So sedentary lifestyle, obesity, genetics. I mean, most diseases are going to be genetics plus the environment. And that's the same thing that leads to diabetes.
You touched on this a moment ago, I believe. Are there symptoms for pre-diabetes that the average person might recognize, or is a blood test the only way?
Usually testing your blood glucose under certain circumstances is going to be the best way. If you become symptomatic, then the chances are you may already meet criteria for diabetes. But if if you are gaining weight, you're less active than you used to be, then you should be aware that you're already possibly setting the stage for that.
Will everyone with pre-diabetes develop full-blown type 2 diabetes?
No, that's the good news, is that not everyone will. It's estimated right now that about 25% or 1 in 4 will over the next 5 years once they were determined to be pre-diabetic. But in some respects, it's difficult to say who is and who isn't the one that's going to go on to have that. So it's always a good idea for people to try to do the right thing with weight loss, good diet, and exercise.
Well, let's say, for the sake of discussion, that we have made a clinical determination of pre-diabetes. How will a patient know if they have developed full type 2 diabetes?
Well, that's where, you know, primary and preventative health care comes in. You should see your doctor and have that monitored. There are tests that can be done. A patient could monitor, you know, their own glucoses at home, but we have other tests that tell us what blood sugars have been running over a longer period of time. So it is important for anybody that has that diagnosis to see their doctor on a routine basis.
I believe you touched on this a moment ago, but let's add some color to it. Can someone who has pre-diabetes, where you've been clinically diagnosed with pre-diabetes, can they stop it from becoming type 2?
Absolutely. And so the biggest trials that we have compared diet and exercise and some modest weight loss against medicines. And the good news is it turns out really changing your lifestyle, eating better and exercising, losing weight works better than medications. You know, you can obviously use both if you want, but we, as diabetologists, we always tell people you need to, you know, eat better, lose weight, and exercise. And at least now we have proof that those things actually do turn back the clock somewhat on prediabetes.
Does prediabetes cause the damage to your body that we know about with respect to diabetes, or do you have to develop type 2 diabetes for that damage to occur?
Well, like I said, it's just an X on the continuum. So there are certain individuals that may having damage before they overtly develop diabetes. And that's because even the pre-diabetes state, or as we might want to still refer to it sometimes, a metabolic syndrome, is an inflammatory condition, and that's usually going to affect your heart. That's also another reason they keep moving the standards back for the diagnosis of diabetes. The blood sugar numbers used to be higher years ago, but studies show that people start developing the problems of eye disease or nerve disease even before they would meet the criteria for diabetes. So yes, there can be some damage going on, but it's more or less individual.
To better understand the potential for developing it, who is at higher risk for developing type 2 diabetes?
In general, we're going to, American Diabetes Association would prefer to screen anybody over 45. In our situations, we want to look at people that are overweight, who have, may already have hypertension or have hyperlipidemia or high cholesterol levels. Anyone that has heart disease should be screened for diabetes. And then there's ethnic and minority groups that have a much higher incidence of it. And so African Americans have a higher incidence, Latinos and Hispanics have a higher incidence, Asian Americans will have a higher incidence. They also have it at a much lower body weight. And then Native Americans and Pacific Islanders are high-risk groups. Other things you should know about actually for high risk is women who've had gestational diabetes mellitus or who have babies that are greater than 9 pounds.
Worst case scenario, what happens if you have either prediabetes or type 2 diabetes and you ignore it?
Well, then you may get the things that we're trying to prevent when you do come to see us and we try to do something about it. So our major concern is still usually cardiovascular disease. It is the #1 killer in America, but in diabetes patients, it's going to be the cause of death in about 75%, stroke or heart disease. So that's one of our #1 and our foremost problem that we worried about with diabetes. The others are going to be the classic things that you're told about when you have diabetes education, and that's the small vessel disease, which includes your eyes for retinopathy, your kidneys, and your nerves. So those are called microvascular complications, and they can become very problematic. Fortunately, things like kidney disease from diabetes is on the down slope at this point.
Well, it being the start of a new year, what New Year's resolution should we consider, particularly if you are tending in this direction, to prevent prediabetes, or if you already have prediabetes, what goals should you set for yourself to prevent it from becoming full-blown type 2 diabetes?
Well, this goes into the thing that most people resolve to do after New Year's, and that's lose weight, exercise, or eat healthier. So some of the most common things that people do would help them to prevent prediabetes or diabetes. And the one thing you should remember or take into account is you don't want to set yourself up for failure. So don't decide that you need to lose a huge amount of weight, or really the studies show that even 5 to 10% of your body weight is very effective at turning back the clock on diabetes. So I would encourage people to those same things: exercise, eat healthier, lose weight, but take baby steps, do it gradually, don't try to do everything at once. And we know from studies that will absolutely help.
Very well. Doctor, thank you so much for your time.
You're welcome.